Health rankings for women and children are out, and we have New Mexico's strengths and weaknesses. Joining us to talk about it is Dr. Denise Leonardi, who is the Chief Medical Officer with UnitedHealthcare New Mexico. So first things first, do we have positive news? Overall, how are we doing here in New Mexico?
You know, overall, we do have positive news.
That's great.
We're 37th, which is not bad given our state and the high poverty rate. 37th, we've stayed there. We also have some other good news. There is low elective C-section rates, which is actually really good for us.
Okay.
Because C-sections have some risks, low prevalence of overweight or obese children, and we also show a low prevalence of excessive drinking among women, which is wonderful for both women and their children.
Yeah, that's fantastic news to hear.
It is.
Excuse me, sorry, I was choking there a little bit. Now, we've got some strengths and weaknesses here, or challenges maybe that we should say. Our producer will pull it up here in just a second. We'll talk about some of this stuff here. What are some of the strengths that we're working with? As you see here, the 2018 New Mexico Women and Children's Health Rankings. Let's talk about our strengths first, Doctor.
Well, the strengths are if women are delivering healthy babies, that's really great. And excessive drinking, you know, if we have women who are not drinking during pregnancy because you shouldn't drink, that's great. So we're not seeing excessive drinking among women. And the obesity rate among children has actually decreased, which is excellent because it can have a generational effect.
Absolutely.
Both for them and hopefully for their future generations.
Absolutely. So that's the things that are going right. Now let's talk about some of our challenges. What have you found out of this this research? Well,
what I have found looking at the health rankings for New Mexico is the high school graduation rate still continues. We tend to be towards the bottom.
Okay.
So that's an issue. And we have a high teen birth rate, which I believe is related to the first issue of graduation rates. Plus, we have a low percentage of women going in for prenatal care prior to their third trimester. If women get in earlier for their prenatal care, problems can be identified and they can be addressed.
Okay.
So those are challenges.
Now, we've also got some data highlights here, Doctor. Let's take a look at this. Let's talk about this, these figures that we're looking at here. Let's start with this food insecurity, up 43%.
Yes, food insecurity really has to do with social determinants of health and poverty. And if you look at the statistics, we do have an issue in New Mexico with poverty. And maternal mortality, that is up 11%, and that really has to do with getting in for prenatal care. Because if we can identify diabetes, or gestational diabetes, we can identify preeclampsia, all of those things, and address them can decrease maternal mortality. But if they're not addressed, we do see a higher maternal mortality rate. And then the low risk cesarean section. Now, the thing about that, those are elective C-sections. Elective C-sections, most C-sections really should be done for emergencies or things, unexpected things showing up. Elective, you know, could be a problem because C-sections are not without risk.
Right, okay. Well, Doctor, we appreciate this information. And of course, we will have links to UnitedHealthcare's website a little bit later on at Fox, New Mexico. This is, overall, it sounds like we're doing okay, though, then. You know, still always room for improvement.
There is always room for improvement, and we, like I said, we have maintained some things and improved others. And I feel with the programs both that United has and other programs with WIC, Women, Infant, and Children, and the Department of Health, that we are making a difference.
There you go, Doctor. Always a pleasure to see you. Again, if you want more information, head over to foxnewmexico.com.